After a family vacation in Las Vegas, Lisa Audette thought she had the flu.
Really intense headache, nausea, fatigue, malaise. My whole body was sore. Also, my eyes were stinging, which was a little bit different for a flu.
Turns out she had COVID-19.
If you had flu, if you had COVID, it's going to be really hard to tell.
Testing will help. However, with the flu season looming, many are worried about overlapping outbreaks.
3, 2, 1.
But scientists say we may have already had a preview of what's coming. Back in March, flu season wasn't over when COVID-19 arrived, and the results were striking.
It was not a gradual easing off of influenza activity. It really was a sudden dramatic drop.
In 2019, stats show about 15% of flu tests were positive in the third week of March. That was about 1,000 cases. This year, at the same time, that line plummets. Public health measures for COVID-19 had kicked in, and flu cases dropped to under 200. Another good sign comes from the current flu season underway in the Southern Hemisphere. Many countries there followed public health messaging and are seeing very low levels of flu virus.
The main message for countries of the North: prepare with a lot of caution your flu season.
Adding, the uptake of flu vaccines has shot up in the South this year. In Australia, the number of flu deaths has dropped from 430 in 2019 to just 36 this year.
I think it would be great if we had no influenza activity like we're seeing in the Southern Hemisphere, but I don't know if we can count on that. So we're really planning for is what if we have flu and COVID at that same time? To that end, Health Canada has ordered almost 2 million extra flu shots, hoping more Canadians will be eager to roll up their sleeves for a protective vaccine that is ready. Christine Birak, CBC News, Toronto.